Bonjour, hello, welcome back. This is Dr. Mark, a DuPéré plastic surgeon, Visage Clinic here in Toronto, Canada. I want to thank my lovely lady for agreeing to this filming. I want to take the opportunity today to go over the 4 major steps in a tummy tuck, also called abdominoplasty. Tummy tucks are by far one of the 2 most common procedures we do along with breast in plastic surgery in Toronto. I call my tummy tuck a 4-step procedure, major step. The first one being liposuction. So I like to turn my patient. So I've already turned her or flipped her, and I was already able to give her a beautiful hourglass as she was very square here. And I've done already the liposuction on that position to show you how powerful the liposuction is to give her back some hourglass silhouette. This is without yet the muscle repair. So liposuction is my first part of a tummy tuck. Second part is the skin excision. Now she's had 1 child before. That skin is loose. You can see loose. She's got stretch mark. You can see even without doing any dissection, the skin will come down. This area from about 6 centimeters above the pubic area, above the genitals, up to the belly button will be excised and removed. Now the belly button is an anchor. The belly button is a scar from the old umbilical cord and blood vessels that she was connected to her mommy in her mommy's womb. This umbilicus or belly button is anchored down to her muscle, goes to the liver. There's a scar tissue going all the way. We leave it attached to her, but I have to detach it from the skin to allow that skin to come down. So in a lot of our tummy tuck, there is an umbilicoplasty component where I will skeletonize the belly button, leave it dangling for an hour or so while I do other work. That skin will be then pulled down all the way to here. That skin here will be pulled over the belly button, which will be inside. I will feel where it is. I will make a new window and I will fish it through and sew it back to her. This is a very important part of the tummy tuck, and it's very important that the new scar be hidden. So we like to anchor down the belly button to the muscle fascia deep, so the skin, when we close it, has no choice but going in, and the scar is then hidden inside the belly button. So umbilicoplasty. The 4th component is the muscle repair. It's a very, very, very important part of the tummy tuck, where the muscle here, and when my patients are in the office, I tell them they're like 2 ties. And with pregnancy, they widen sideways and forward, which allows the guts and all the organs to protrude, and also gives our ladies a very square look. So when I'm inside, I will plicate or repair the muscle back together from the chest bone all the way to the pubic bone, and that will help her to get back that hourglass shape. In our ladies, we obviously go mid-waist, where we're going to really make it as tight and narrow as possible to get that hourglass shape. I will flex her. I will sit her up when we're almost done to decide if I can go a little bit higher or not. And then we'll do some quilting sutures inside to help preventing seromas and hematomas. And then she's staying overnight. We did a larger volume liposuction. Tummy tuck. Tummy tuck is painful, but totally worth it. Those muscles here are not cut as one would do in a C-section, but they are repaired together. And you need those muscles to stand, to sit, to come out of bed, car, toilet seats. So that muscle repair will give her some discomfort for the first 4, 5, 6 days. We keep them overnight to help them with 2 nurses. And then I do recommend for the next 2, 3 days to have somebody at home, a partner, a sister, a mother, to help walking around, to go to the washroom, to feed, and all that important activities of daily living. Tummy tuck is very, very, very common and a very successful procedure in restoring pre-baby's body silhouette in our ladies. I thank you all for watching. Please do comment below if you have any question. I'll be happy to answer. Have a lovely day.